Innovation is having the courage to turn ideas into actions.
Innovation is thinking outside of the box.
Innovation means putting our patients and their families first.
Innovation requires imagination and motivation.
Innovation is the answer to this question: how can I do this better in a different way?
The joint centers are the coming together of 6 leading community hospitals to create a new platform to share innovations and spread new ideas across a broader part of the healthcare system, but also to create new ideas to improve the quality of care and to improve value for the taxpayer.
Here at Markham-Stouffville Hospital, our mission is to provide safe, high-quality healthcare to all our patients. One of the ways we achieve this is using state-of-the-art technology to manage our medications. We use barcoding to drive our box picker that allows us to accurately select each medication specific for the patient. We use the pneumatic tube to transport the medication to the patient care units safely and quickly. We embraced innovation by being one of the first community hospitals in Canada to use box picker technology.
This is where technology really meets patient care for me, right at the bedside. The state-of-the-art technology allows me to give the right medication to the right patient every time.
The innovation is a positioning system to make space in the shoulder for doing shoulder arthroscopic procedures where no space normally exists. It's what we call a beach chair traction positioning system that opens up space to allow the surgery to be safer and quicker. It really came down to a hybrid between the 2 existing solutions, so positioning them in the orientation that I wanted them in, but then coming up with a way to apply traction and use leverage with an axillary roll to open up space. You know, space is everything in orthopedics. When using power tools and instruments, you don't want to do damage in cartilage, so having that space to move around makes it a safer, quicker surgery. Providing expert care close to home in our catchment area is really our reason for being here, and I take that task to heart and to do the best job that I can.
Our population is aging and therefore more susceptible to infection. That is why we need to continue to innovate to ensure patient safety. Our innovation is our multi-pronged C. difficile management program. It includes our multidisciplinary approach to hand hygiene, environmental cleaning audits, using bleach in all patient rooms, and UV light, and our award-winning antimicrobial stewardship program.
We've seen great success with the Toronto East General program since we started in 2010. Working with the end user from the ground up, we developed an innovative program that's led to a marked reduction of the use of our broad-spectrum antibiotics, our heavy-hitting antibiotics, by about 30%. And we've done all that while being fiscally responsible and saving money.
These innovations have been pivotal to our success. We've seen a 50% reduction in hospital-acquired C. diff cases every year over the past 5 years. These innovations wouldn't have been successful without the people and their passion for innovation.
The cardiac care program at South Lake Regional is celebrating now 10 innovative years in the management of patients with cardiac disease. As the 3rd largest cardiac program in Ontario, our team has managed to transform the lives of 100,000 patients. As a regional centre, we thought it was important to become involved in new innovation to stay in the cutting edge. We've embarked on TAVI procedures, which is percutaneous aortic valve replacement. We're doing minimal mitral valve surgery and using innovative valves such as the sutureless Percival mitral valve. We are recognized not only nationally but internationally for the services that we provide in electrophysiology, angioplasty and cardiac surgery. Our ongoing commitment to research and innovation is what helps us bring the best and most cutting-edge care to our patients.
At Mackenzie Health, our patients are at the center of everything we do. We know that it takes a dedicated healthcare team supported by an innovative practice setting to create a positive, healing environment, starting with our patients, who are cared for in smart beds that communicate data in real time to help reduce falls. From the skilled and knowledgeable nurses who are directly notified of their patients' needs through smart technology, to our dedicated physicians who can monitor and intervene remotely based on real-time status updates, and our staff who use electronic signage and technology to support protocols for infection control practices. We are proud of our team and how they are leveraging a first-of-its-kind innovation unit in Canada to redesign and revolutionize patient care to create a world-class health experience for patients, families, and our community.
eCare is our clinical transformation initiative utilizing healthcare technology. Its ultimate goal is to improve patient outcomes. What we've come to realize is not only eCare is providing innovation at the front line, but it's also become a platform for continuous innovation at the hospital.
In the past, we had a system that worked very well for our maternal newborn program, but it existed independently from the rest of the hospital. With the introduction of Power Chart Maternity, Fetal Link, SurgiNet, and SurgiNet Anesthesia, we have a completely integrated system throughout the hospital. The greatest impact on patient care is the integration of the systems. This leads to better continuity of care and greater patient safety.
When it comes to innovation, eCare has made a profound impact at the point of care. Both our clinicians and our patients get to experience all the innovative change that we made at the front line, and it's definitely improving patient outcomes.
It's important that community hospitals innovate and share their innovation for a number of reasons. We happen to serve a very large portion of the province of Ontario, but more importantly, we have a history amongst the 6 members of being places where practical, doable, realizable new ideas get developed, nurtured, and implemented. And it's that practical approach of innovation and change that really gives community hospitals a unique niche in the broader healthcare system.
Innovation requires the courage to think beyond current practices.
Innovation is about recognizing the needs of the people in our community and addressing these needs through collaboration and providing the best care for our patients.
Innovation means embracing change and having the courage to be first.
Innovation, it happens here.